50 emergency situations everyone handles wrong. You've been taught to put butter on burns, tilt your head back for nosebleeds, and perform CPR like they do in movies. But what if I told you that following these common emergency tips could actually make things worse, or even deadly? Starting at number 50 and counting down to the most shocking emergency mistake that 99% of people make, here are the life-threatening errors you need to stop making right now. Number 50. Using hydrogen peroxide on fresh wounds. We've all reached for that brown bottle when we get a cut, right? That satisfying fizz makes us think it's killing germs. But here's what's actually happening. Hydrogen peroxide is destroying your healthy tissue cells along with the bacteria, significantly slowing down healing. Studies show wounds cleaned with just soap and water heal 50% faster. Your body's white blood cells are already equipped to fight infection naturally. Save the peroxide for cleaning your bathroom, not your body. Number 49, putting ice directly on burns. Your first instinct with a burn is to grab ice. Seems logical, right? Cold stops heat, but ice can cause frostbite on already damaged skin, creating what doctors call a dual thermal injury. Instead, run cool, not cold, water over the burn for 10-20 minutes. The temperature difference between ice 32 degrees and cool water 60-70 degrees might seem small, but it's the difference between healing and permanent scarring. Number 48. Tilting your head back during nosebleeds. This one's been passed down for generations, but tilting back just sends blood down your throat, which can cause nausea and vomiting. Worse, you could aspirate blood into your lungs. The correct method? Lean slightly forward, pinch the soft part of your nose, not the bridge, and breathe through your mouth for 10 minutes. This position lets blood drain out naturally while the pressure stops the bleeding at its source. Number 47, inducing vomiting after poisoning. Those old poison control stickers used to recommend syrup of ipecac to make someone throw up. But vomiting can actually make certain poisons worse. Caustic substances burn twice, going down and coming up, and petroleum products can be aspirated into lungs. Modern poison control says never induce vomiting unless specifically instructed. Call poison control first. They'll know exactly what to do based on the specific substance. Number 46, moving someone with a potential spinal injury. You see someone fall and your instinct is to help them up or make them comfortable. But moving someone with a potential spinal injury can turn temporary paralysis into permanent damage. Unless they're in immediate danger, fire, drowning, don't move them. Stabilize their head with your hands or rolled towels and wait for paramedics. Those few minutes of patience could save someone from a lifetime in a wheelchair. Number 45, rubbing frostbitten skin. Rubbing frostbitten areas seems like it would restore circulation, but you're actually causing more damage. Ice crystals in the tissue act like tiny knives when rubbed, shredding cell walls. Never rub or massage frostbite. Instead, rewarm gradually with warm, not hot water at 98 to 102 degrees Celsius. The rewarming will hurt. That's actually a good sign that nerves are still functioning. Number 44, using butter or oil on burns. This old wives' tale needs to die. Butter, oil, or any greasy substance traps heat in the burn, essentially continuing to cook your skin. It also increases infection risk. Stick to cool running water, then cover with a clean, dry cloth. Save the butter for your toast, not your medical emergencies. Number 43, removing objects impaled in the body. Your instinct says, get it out. But that object might be plugging a damaged artery. Removing it could cause massive bleeding. Instead, stabilize the object with bulky dressings on either side and get to an ER immediately. Surgeons need to be ready to control bleeding the moment it's removed. Yes, it looks dramatic, but leave the drama to the professionals. Number 42, giving water to someone having a seizure. Never put anything in the mouth of someone having a seizure. Not water, not a wallet, not your fingers. They can't swallow their tongue, it's physically impossible, but they can choke on objects or bite your fingers off. Instead, move nearby objects away, cushion their head, and time the seizure. Most stop within 2 minutes. Call 911 if it lasts longer than 5 minutes. Number 41. Applying a tourniquet for minor bleeding. Hollywood makes tourniquets look like the go-to for any bleeding, but they should be an absolute last resort. Cutting off all blood flow can cause permanent nerve damage and tissue death in as little as 2 hours. For most bleeding, direct pressure with a clean cloth works perfectly. Save tourniquets for life-threatening arterial bleeding where direct pressure fails, and mark the time you applied it. Number 40. Drinking alcohol to warm up in cold weather. That warming sensation from alcohol? It's your blood vessels dilating, which actually makes you lose heat faster. Alcohol also impairs your shivering mechanism, your body's natural heating system. In survival situations, alcohol can accelerate hypothermia. Stick to warm, non-alcoholic beverages and layer up instead. Number 39. Sucking out snake venom. Every survival movie shows someone cutting and sucking out venom, but this cowboy medicine does more harm than good. You can't suck out venom. It spreads through tissue in seconds. Cutting creates additional tissue damage, and your mouth bacteria can cause serious infection. Instead, keep the victim calm. Slower heart rate, slower venom spread. Remove jewelry before swelling starts and get to a hospital. Don't waste time playing doctor. Number 38. Using your phone flashlight to search for gas leaks. Seems safe because it's not a flame, right? Wrong. Your phone's battery and circuits can create sparks, especially if you drop it. Gas leak protocol. Don't flip switches. Don't use any electronics. Don't even adjust the thermostat. Exit immediately and call 911 from outside. That Instagram story can wait. Number 37. Leaving someone sleep off alcohol poisoning. They just need to sleep it off. Kills college students every year. Alcohol poisoning can cause breathing to slow to dangerous levels or stop entirely. The person can also choke on vomit while unconscious. If someone's passed out and you can't wake them, that's a medical emergency. Put them in the recovery position, on their side, and call 911. Better to be embarrassed than dead. Number 36. Trying to catch a falling knife. Your reflexes betray you here. A falling knife has no handle is a saying for good reason. Let it fall, step back, and clean up the mess. Catching it risks severing tendons, nerves, or arteries in your hand. The few seconds saved aren't worth potentially permanent hand damage. Number 35. Running from a bear. Running triggers a bear's chase instinct, and they can hit 35 millimeters. You can't outrun them. For black bears, make yourself large and loud. For grizzlies, play dead if attacked. For polar bears, well, you shouldn't be where polar bears are without proper protection. Never run from any bear. Back away slowly while facing them. Number 34. Drinking seawater. When dehydrated, desperate times, but this desperate measure will kill you faster. Seawater is about 3.5% salt, while your body is 0.9%. To process seawater, your kidneys need more fresh water than you're taking in, accelerating dehydration. You'll start hallucinating within hours. If stranded at sea, collect rainwater or dew instead. Number 33. Performing CPR like in movies. Movie CPR has people coughing up water and waking up after a few pumps. Reality: proper CPR breaks ribs, takes sustained effort, and has about a 10% success rate outside hospitals. But that's still 10% better than doing nothing. Push hard and fast, 100 to 120 compressions per minute, to the beat of Stayin' Alive. Don't stop until paramedics arrive. Number 32. Using candles during power outages. Cozy? Yes. Safe? Not really. Candles cause over 20 house fires daily during power outages. One knocked over candle in the dark, and you've traded a minor inconvenience for a major disaster. LED lanterns or flashlights are far safer. If you must use candles, place them in deep holders on stable surfaces away from anything flammable. Number 31. Hiding under highway overpasses during tornadoes. This myth has killed dozens. Overpasses create wind tunnel effects that actually increase tornado wind speeds. Flying debris gets concentrated in these spaces. Instead, abandon your vehicle and lie flat in the nearest ditch, covering your head. It's counterintuitive, but lower is safer in a tornado. Number 30, giving aspirin to children with fevers. Aspirin in kids with viral infections can cause Reye's syndrome, a rare but potentially fatal condition causing brain and liver swelling. This connection wasn't discovered until the 1980s, so many adults remember taking aspirin as kids. Use acetaminophen or ibuprofen instead. This is why children's aspirin essentially disappeared from store shelves. Number 29, urinating on jellyfish stings. Thanks, friends, for spreading this myth. Urine can actually trigger more venom release from jellyfish cells still on your skin. The solution? Rinse with seawater, not fresh water. That also triggers venom release. Then apply vinegar or hot water. Yes, you'll smell like a salad, but you'll be in far less pain. Number 28, breaking car windows with headrest prongs. This viral life hack rarely works and wastes precious time. Car windows are laminated. Headrest prongs aren't designed for breaking glass. Invest in a proper window breaker with your seatbelt cutter tool and keep it within reach. During submersion, you have 30-60 seconds before water pressure makes doors impossible to open. Number 27, giving insulin to any diabetic emergency. Not all diabetic emergencies need insulin. Giving it during low blood sugar can be fatal. If they're conscious, give them sugar, juice, candy. If unconscious, never put anything in their mouth. Call 911. Paramedics can test blood sugar instantly and give the right treatment. Your guess could be deadly wrong. Number 26, using elevators during fires. Elevators become death traps in fires. Power can fail, trapping you. Elevator shafts act like chimneys, filling with smoke. The heat can warp doors, preventing opening. Always use stairs, stay low under smoke, and feel doors before opening. Hot door means fire on the other side. Number 25, mixing cleaning chemicals for extra power. Bleach plus ammonia, isocyanine chloramine gas. Bleach plus acid, cyanochlorine gas. Both can kill you. That extra cleaning power is actually chemical warfare. These gases were used in WWI. Never mix chemicals. If you accidentally do, evacuate immediately and call poison control. Open windows from outside if possible. Number 24, leaving electrical devices plugged in during lightning. Lightning can travel through electrical wiring, water pipes, and phone lines. Surge protectors won't stop lightning. It jumps 15,000 decommodity plasma through air. A tiny circuit breaker is nothing. Unplug electronics, avoid plumbing, and stay off corded phones during storms. Cell phones are safe. They're not connected to anything. Number 23, using petroleum jelly for burn treatment. Like butter, petroleum jelly traps heat. But it's worse. It's petroleum-based, making it harder to clean off at the hospital. Doctors need to see and assess the burn, and scrubbing off sticky substances causes additional pain and potential damage. Stick to cool water and loose, clean covering. Number 22, attempting to rewarm hypothermia victims too quickly. Rapid rewarming can cause afterdrop. Cold blood from extremities rushing to the heart, potentially causing cardiac arrest. It can also cause irregular heart rhythms. Rewarm gradually with blankets and warm, not hot beverages if they're conscious. Let their body do the work slowly and safely. Number 21, storing medicine in bathroom cabinets. The moisture and temperature changes in bathrooms degrade medication faster. That life-saving EpiPen or critical heart medication might be useless when you need it. Store medications in cool, dry places like bedroom closets. Check expiration dates regularly. Expired meds in emergencies can be ineffective or dangerous. Number 20, performing Heimlich maneuver on infants. Adult Heimlich on babies can rupture organs. For infants under 1 year, 5 back blows between shoulder blades, then 5 chest thrusts. Their organs are tiny and delicate. Adult force is devastating. Learn infant CPR before becoming a parent. Those few hours of training are worth more than any baby gear. Number 19, drinking your own urine for survival. Bear Grylls made it famous, but it's terrible advice. Urine is 95% water, but that 5% is waste your body's trying to eliminate. Drinking it makes your kidneys work harder, accelerating dehydration. It's like drinking seawater. Seems logical, but makes things worse. Focus on finding actual water sources instead. Number 18. Using a belt as a tourniquet. Belts are too wide and can't generate enough pressure to stop arterial bleeding. They compress tissue without stopping blood flow, causing damage without benefit. Proper tourniquets are 1 to 2 inches wide and can be tightened much more. If you don't have a real tourniquet, use a strip of cloth with a windlass. Stick to twist it tight. Number 17. Trying to stop a seizure by restraining someone. Holding someone down during a seizure can cause broken bones, dislocated joints, or muscle tears. They're not in control. Their muscles are contracting with incredible force. You can't stop a seizure by restraining it. Clear the area, cushion their head, and let it run its course. Time it. That's the most helpful thing you can do. Number 16. Using alcohol to clean wounds. That burning sensation? It's alcohol killing your healthy tissue cells along with bacteria. Alcohol delays healing and increases scarring. It's great for sterilizing instruments, but terrible for open wounds. Soap and water remain the gold standard. Boring, but effective. Number 15. Waiting to feel thirsty before drinking water. By the time you feel thirsty, you're already 2% dehydrated. Enough to impair judgment and physical performance. In survival situations, this puts you behind the curve. Ration water wisely, but drink regularly. Clear urine means you're hydrated. Dark yellow means you're already in trouble. Number 14. Using matches or lighters to remove ticks. Heat makes ticks regurgitate their stomach contents into your bloodstream, including any diseases they carry. It also makes them burrow deeper. Use fine-tipped tweezers, grasp close to skin, pull straight up with steady pressure. Save the tick in a sealed bag for disease testing. Number 13. Assuming clear water is safe water. Crystal clear mountain streams can harbor Giardia, E. coli, and other pathogens. You can't see, smell, or taste most waterborne illnesses. Boil for 1 minute, 3 minutes above 6,500 feet elevation, or use proper purification. That pristine stream could give you debilitating diarrhea, potentially fatal when you're already struggling to survive. Number 12. Covering electrical burns. Electrical burns are icebergs. Surface damage hides massive internal injury. Covering them can trap heat from ongoing tissue damage. These need immediate medical attention, as electricity follows blood vessels and nerves, causing hidden damage. Internal burns can continue developing for hours. Number 11. Using smelling salts on unconscious people. Old movies show someone waving smelling salts to wake people up. In reality, if someone's unconscious from head injury, the ammonia inhalation can cause respiratory problems. Plus, suddenly waking someone with potential brain or spine injury risks further damage. Check breathing, call 911. Don't play doctor with chemistry. Number 10. Jumping from heights into water to escape fire. Water becomes concrete hard at high speeds. From 100 feet, you hit water at 55 km/h, enough to break bones, rupture organs, or knock you unconscious. Even if you survive impact, broken bones make swimming impossible. Unless the alternative is certain death, never jump from extreme heights into water. Number 9. Pulling out barbed fishing hooks. The barb is designed to prevent removal. Pulling causes massive tissue damage. The proper technique: push the hook through until the barb exits, cut off the barb, then back the shaft out. Yes, it means more initial pain, but far less damage. For hooks near eyes or in the throat, never attempt removal. Straight to ER. Number 8. Using credit cards to stop severe bleeding. This military myth suggests sliding a credit card into a wound to stop bleeding. It doesn't work and introduces bacteria into deep tissue. Plastic can't create enough pressure to stop arterial bleeding. Use direct pressure, elevation, and pressure points. Credit cards are for buying proper first aid supplies, not becoming them. Number 7. Giving CPR to someone with a pulse. CPR on a beating heart can cause fatal arrhythmias. Always check for pulse first. Use carotid artery in the neck, not wrist. No pulse. Start CPR. Pulse but not breathing. Rescue breathing only. This mistake happens because panicked people skip the pulse check. Those 10 seconds to verify could save a life. Number 6. Treating all chest pain as heartburn. And It's just indigestion kills thousands annually. Heart attack symptoms vary wildly, especially in women who might experience jaw pain, nausea, or fatigue instead of chest pain. If chest discomfort lasts more than a few minutes, call 911. Better to be embarrassed in the ER than dead at home. Time is heart muscle. Number 5, using duct tape for serious wounds. MacGyver made it look smart, but duct tape adhesive causes severe skin damage and traps bacteria. Removal tears healing tissue, restarting bleeding. It's also not sterile. Carry proper medical tape or use clean cloth strips. Duct tape fixes everything except human bodies. Number 4, ignoring minor head injuries. Natasha Richardson's death showed how minor head bumps can be fatal. Epidural hematomas have a lucid interval. You feel fine, then suddenly deteriorate. Any head injury with loss of consciousness, confusion, or worsening headache needs immediate medical attention. Your brain doesn't have pain receptors. By the time you feel really bad, it might be too late. Number 3, breaking your fall with outstretched arms. Instinctive but often wrong. Straight arm falls commonly cause callus fractures, broken wrists that can require surgery and months of recovery. Better to roll with the fall, protecting your head while distributing impact across your body. Parkour practitioners learn this first, how to fall safely. Bruises heal faster than broken bones. Number 2, removing protective gear to cool down. In extreme heat, people remove helmets, bulletproof vests, or protective clothing. But heat stroke impairs judgment first. By the time you decide to remove protection, you're already making bad decisions. In dangerous environments, protective gear matters more than comfort. Heat exhaustion is treatable. A head injury might not be. Number 1, assuming you'll remember emergency procedures under stress. Here's the most dangerous mistake of all: believing you'll remember any of these corrections when real emergencies hit. Under extreme stress, your prefrontal cortex shuts down. You revert to instinct and old habits. The only solution: practice. Take first aid courses. Run drills. Build muscle memory. Because in true emergencies, you don't rise to the occasion. You fall to your level of training. Your life and the lives of those around you might depend on replacing these deadly myths with proper responses. Don't just watch this video, act on it. Now you know the 50 emergency mistakes that could cost lives, but knowledge without action is useless. Take a first aid course this month. Build a proper emergency kit. Share this video with people you care about. These myths kill because people don't know better. Which of these mistakes surprised you the most? Comment below, and remember, in emergencies, what you don't know can literally kill you. Stay safe. Stay PR.